Low back issues getting in the way of your workouts or training or doing the things you'd like to do. In this video, I'm going to show you my go-to exercise to solve this. What's up, guys? My name is Dr. Nick Bonforte, physical therapist. So in this video, I'm going to be looking at it from the perspective of dealing with low back pain with flexion-based movements. Things like sitting down for a long time, bending over in your workouts like deadlifting, which requires the bending over. Things like that spark up the back pain. That's what I'm going to be addressing in this video. Real quick though, if you're dealing with anything that's numbness or tingling, going down the leg, radiating symptoms, or more of a sinister pathology, then this video is not for you and you should definitely get that looked at. Now, without getting too specific in the details of why low back pain comes up with flexion sensitivity types of issues, we're just gonna go over the exercise that tends to do really well from a clinical standpoint when we're dealing with low back pain that is sparked up with these types of movements of flexion. So this go-to exercise that I start with is extension-based movements, or the prone press-up progression. That's basically just literally lying flat down on your stomach. And then there's progressions to that. So the first one I start with is lying face down, and you're just breathing. And the idea with that is when we're breathing, we're taking a breath in and going down. We're just thinking about the low back sinking towards the ground. That's helping the low back move into this extension-based movement. A progression off of this is propping yourself up on your elbows and doing the same exact thing. The idea is just to get the low back more tolerable to this extension-based movement. And then lastly is the press-ups that I would use. So that would be the progression that I would go. I would go face down on elbows and then press ups. And this is the idea with this, is just moving into extension, the complete opposite of what typically is sparked up with these types of low back clients, which is bending forward, which is flexion-based movement. So this is the progression that I initially start with these types of clients, and it seems to do really well in lowering the pain and the symptoms that they're experienced if we're just talking about that these flexion-based movements tend to spark it up. Now, starting face down and then going onto the elbows and then pressing up, is that the sequence for everybody? No. Some people don't need to start face down and they can go right into the press ups, but that would be the progression of moving up into the actual press up. And the idea again is to move the back into this extension-based movement, which typically tends to do really well in solving some of the issues that these clients deal with in their low back. Now, like I said before in the video, I'm not going into any of the details of the anatomy and the pathology and what we think is happening. This is just a broad overview of this exercise tends to do really well in the clinic for these patients that deal with low back pain. So at the end of the day, if it's helpful for the person and it does something for their symptoms and it empowers them to move more and get going and lower their back pain, then why not? It's a great exercise to start with. Also, is this exercise for everybody? Absolutely not. That's why it's so important to make sure you're getting an individualistic approach when you're dealing with particular issues at your low back. Guys, if you did learn some things throughout this video and found value in this, I would really appreciate it if you subscribe, like, comment, leave any questions below, and also turn on your post notifications so you never miss a video when I release it. And also, if you want to learn more about some of the programs that I have for the low back and other regions of the body, then check out my website. I'll leave the link in this video or down below in the description. Click to head you right over to the website. Check it out and see if they'd be even beneficial for you. This is Dr. Nick. I'll see you next time.